Good morning, YouTube. Matt M. Roy back once again, trying to get the best possible lighting situation here. You know, that's always a struggle. Oh boy. Well, I don't know how many of you have actually been able to come to the live streams recently. I know that some of you out there are probably in church right now, which is where I should be, but I got up a little late. The time delay or the time change kind of threw me off a little bit. Hope everybody's doing well out there. Man, lighting is just a big problem today. I'm either getting washed out or I don't look very good here. Let me try to shift this around a little bit while we get some more people here. That just kind of makes me look yellow. I know this one I don't think has another one. We'll have to go with this. I think it looks okay. She's now hidden. The message is held for review. Hello, Matt. George Blakely's here. I guess somebody deleted a message. I didn't see it anyway. Give me just a minute. Let me try to get, like I said, the best possible lighting. I think that'll work. All right. So I wanted to give everybody an update post-surgery. So this is roughly 4 weeks out, a little less. 4 weeks. It'll be 4 weeks tomorrow. So this is actually 3 weeks and 6 days out post-surgery. For those of you that don't know, after my extreme weight loss, I've had to have skin removal surgery. And this is the revision to the first skin removal. So basically, I went and had the first surgery last year, and they got almost everything done they needed to get done. But then there was a little bit more that needed to be done post surgery. So basically, they couldn't get all the skin the first time, and believe it or not, there is going to be a third surgery, and that's going to be to do the thigh area. So this is definitely a lengthy process. It's taking a lot longer than I thought it was going to take. I was hoping to get it all done in one surgery. Well, that was kind of wishful thinking on my part. Hope everybody can hear me. I'm going to turn the gain up just a little bit because I'm not actually talking directly into the microphone this time. But hopefully everybody can hear me just fine. Let me try to turn the light on back here, see if that makes any bit of difference. Okay, that's a little bit better. So we'll wait a minute or two, see if anybody else comes in. I figured people probably going to be in church, so I didn't know how many people were actually going to show up to this particular live stream. So results. There are a few things you got to keep in mind. You're always going to have somewhat of a scar, or scars in my case, but it's not that bad. Basically, they'll heal up and they'll be almost invisible. Now, the one thing you got to remember with skin removal surgery, and especially when it pertains to scars, is you got to keep them while they're healing. You got to keep out of the sun, or at the very least, if you're going to go into the sun, you need to make sure that you have it covered with something that has an SPF in it. So basically, you need to have something that has what do they call it? No, my mind just went blank. Sunscreen. So it's really important that you take care of your body post surgery. Now, I am, like I said, we're going to say 4 weeks out, and everything is looking pretty good this time. I'm still a little sore, so I got to kind of take it easy a little bit. Now I'm able to exercise. After 2 weeks, they'll allow you to exercise. They'll allow you to go out and take walks. There's still a lifting restriction. I'm not able to lift anything over 10 pounds, and that's going to be for the next let's see, probably about 4 weeks. So I got about another 4 weeks before I can actually lift. And for the time being, I have to wear what's called a compression garment, which is this thing right here. I know it's kind of being drowned out by this, but it's a compression shirt. So basically, I have this on, and it pushes everything in because after the surgery, your skin is still a little loose, and that's something that will basically get better over time. But the shirt is going to help with that. It's going to keep everything in place while it heals. Now, that being said, there are a few things that you can do to help yourself out. I have a daily skin routine now. So, if any of you out there are going through the same thing, if you had an extreme weight loss and you had the surgery, you're like, okay, what do I do now to basically keep or get the best results, let's say? So, I've kind of put together a little bit of a skin care routine, if you will. Number one, which is really, really important, and I hope a lot of you see this later on. I know most of you, again, are probably in church right now, but I'm sure a lot of you will see this in post production. This is a recommendation from my plastic surgeon, and this is what they call Aquifer. Yeah, I know it's backwards, but I'll read it to you. It's called Aquifer Healing Ointment Advanced Therapy. And this is good for scars. You can actually put this on your incisions as they heal, and it'll help them heal faster. It moisturizes your skin, so your skin will start to look nicer. It'll firm up a little bit. Um, Definitely buy this. I think Walmart has a generic one if price is a concern for you. This was about $15, so this isn't cheap. I think you can get the Equate version for probably about half that. But they were out when I was at my Walmart, so I basically just picked this one up, saying, you know what, it's more important that I start the skincare routine now. So definitely start with Aquifer. I put this basically over everything in the morning. Um, Now, next is something that I started myself, and I actually had to ask my plastic surgeon if this was safe to use, and he said it's fine. Um, this is by Avon, and it's called Anew, Anew. And basically, this is a firming cream because, again, when you've lost a lot of weight, you've changed your body, your skin loses a lot of its elastin, which is basic, or collagen and elastin, which is basically what makes it look younger and firm. And this will actually help. Let me see if it'll focus on that. There you can see it. A new Ultimate Day Firming Cream by Avon. And again, this is not cheap. This is probably, I gotta look, see what I paid. Let me look it up and see what I actually paid for that. Oh, I need to reorientate this monitor. I got to work on getting a better monitor stand here for sure. Picked this up on eBay, and this was purchases. I got it for $17, and let me see if I can. Let me see if I can give you guys a link there because they do have more of them. Yeah, there we go. So I'll send the link out for some of these. So this one's for the Avon cream. Generic. What's it called? Aquaphor. Healing ointment. That's the Aquifer. That's the actual brand. If anybody has any questions while I'm doing this, you all can write it in the chat section there. Equate. Because Equate is the generic Walmart brand. Let me see if they actually have one. Is that the same? Is that the same as Aquifer? Let me look at the ingredients here. Yeah, it's actually not that much cheaper. I would have thought it'd been cheaper than that, but this is the Walmart generic for the Aquifer, and I gotta try to do something with that URL. See if I can shorten that up so at least I can share it with you. Sometimes when I do that, it still doesn't work. There we go. Make sure that works. Okay, yep. Hold on. Hold on. I sent you guys the wrong one here. Hang on. Why is that going to the wrong? I don't know why that's going to the wrong one. Now, let me try that again. So we got 3 people here. Hopefully everybody's doing well today. Shorten URL, copy. Okay, I don't know why that one's not working, but at the very least, you got the actual Aquifer brand one. And then number 3, I picked up just the Equate Beauty Moisturizing Cream. I'll get a little close up on that for you. Equate moisturizing, and this has the what they call hyaluronic acid. Now, the hyaluronic acid is actually going to help moisturize the skin. I haven't actually done it this morning, so my face kind of does look a little bit dry today. Um, but the combination of the 3, the Equate, the Avon, and the Aquifer, are going to help you tremendously when you're recovering from this type of surgery. And it's going to be a slow process. Believe it or not, I'm not a patient person. Never have been. Probably never will be. So um, I wanted the results to be kind of dramatic right away, and unfortunately, that's just not the case. When you have this kind of surgery, there's there's kind of a healing period, and again, one thing you got to remember is it takes up to I'm trying to think, what did they say, up to every 7 years basically your body replaces its skin. So basically after 7 years you get new skin. So when you think about it, that means that after 7 years your skin is basically going to look new, providing that you're doing everything you're supposed to, that you're keeping to your diet, that you're exercising, that you're doing a good skincare routine. And if that's the case, then yeah, you should be good to go. Wow, this is driving me crazy, folks. I can't believe this lighting is so bad today. Um, but other than that, so we talked about the skincare routine, and basically keeping out of the sun. And if you have to go into the sun, you want to make sure that you have your basically everything covered up. And that's why sometimes I'll wear long sleeved shirts and try to go out as little as possible. But I gotta walk. I mean, that's my thing. I'm an exerciser. I love to walk. I love to have to do physical activity. So basically, I'm gonna just have to keep it covered, and you'll probably have to do the same thing as well. So if you have any questions or anything, you guys can ask me right now. I don't want to do this too long because I do have some other things I want to accomplish today, or at least try to accomplish today. Um, Hopefully everybody's doing well out there. I know posts human malware, as Adrian Black would say. Everybody's kind of stressed out at the moment. So, just try to take it easy as much as possible. I'm going to open up the Avon real quick because this is actually brand new. Unboxing. You got to love it. Got to love unboxing. Open that up real quick. And this is what it looks like. They actually don't give you a lot, mainly because it's, really expensive. And this actually has a nice scent too. This has got, it kind of does smell like sunscreen, honestly. So I'm going to put a little bit on. Well, again, you want to do it conservatively. So let me take my glasses off here. So you don't really need a lot when you do this. Like for my face, that's probably enough. That and what I just put on. So I rub it in, and you want to massage it as much as you can. Now with me, just in my case, I don't really need a lot up here. I do some on the face, just the neck area to kind of keep that firm. I was lucky when I lost the weight that fortunately my neck mostly firmed up. I got a little something there once in a while, but that's just probably because I'm a little dehydrated right now. I haven't drank as much water as I should. So you put a little bit of that on, and that's really all you need. You just want to keep yourself hydrated. Go ahead and put the cap back on. I put that elsewhere, but you guys get the idea. I'll just show you on my face. And then I don't need the Aquifer on the face, but I do use the Equate Beauty Moisturizing Cream. And I know a lot of guys out there are like, oh, who cares? We're guys, right? We don't need a skincare routine. Well, have you seen some of the older gentlemen out there, especially in their, I would say, as early as late 50s, early 60s, that spent their lives, in construction and didn't take care of their skin? Well, I hate to tell you, a lot of those guys look like Fester Adams, if you know what I mean. It's it's something that I probably should have did when I was a little bit younger too, just taking care of the skin. It's something that a lot of us probably neglect more than we should. All right, so that's done for now. And I usually do that twice a day, especially if I'm going to shower. If I'm going to shower, I definitely do it twice a day. That's good. George is doing well. I'm glad you're doing well. Let me stick my glasses back on so I can see you all again. So that's basically the skincare routine. And, some people, they're going to do it differently than I do. And of course, it's different for everybody out there. If you have different needs, then you're going to be using different products. For me right now, the Aquifer is the most important because that's actually helping heal the scars from the surgery. And that's what you want. You want those scars to heal as best as possible. And I actually didn't do my due diligence the first time when it came to the scars on my arms, and they're just starting to heal up nicely now because I'm using the Aquifer. Let's see. So we talked about the skincare routine. We talked about results post surgery. Now, one other thing I wanted to address is the actual tightness results that you can expect. It can be a little disappointing because at first, right after the surgery, things are swollen, things are still a little bit out of place. You're not going to see the final results until about 2 years out, and that's I'll be honest with you, that's disappointing to me because I really wanted to see it immediately, and in a way, I was kind of lucky because the revision actually corrected some of what I was unhappy with. But again, you got to remember you have to give your body time to heal. Your body's been through a huge trauma with that surgery, and it's really just got to have time to heal up. Everything's got to have time to firm back up again. And don't worry, as long as you're doing what you're supposed to do, it's going to heal. Um, when it comes to actually getting the surgery itself, I wanted to talk just a little bit about the insurance side of things because that was a question I think a few of you had out there is, how in the world do you get insurance to pay for it? It's cosmetic surgery. Yes, it is cosmetic surgery. However, in most cases, when you have extreme weight loss like I did, it's a burden on your daily life. Like there are certain things that you can't do. The skin is so loose that, if you were to try to run or jog or something like that, it would just be flapping all over the place. And that was the case for me. So what happens is the insurance deems it as a quality of life issue. And it's easier than you think to get it qualified as that. So basically what you do is you find a good plastic surgeon, you find someone that can work with you, make sure you go to their surgery scheduler, you explain the problem and you say, look, I have this, and this, and it's causing me issues with my quality of life. More times than not, insurance will cover it. Now, you're probably going to have to submit it more than once. In my case, it was like 3 different submissions before they actually approved it. Justin Lyon says, "Yo, Matt. Hey, Justin, how you doing out there? Hope you're having a good Sunday." Um, Again, if you have any questions, stick them in the comments section. I'll go on a few more minutes, but that's basically what I wanted to talk about. So, what do you say? Shampooing my carpets with Bissell solution. Well, we're actually talking about skincare and post surgery this time, but that's good. Something you need to get done. I probably should clean my carpets again. It's probably been a few months now, and they get dirty pretty quickly when you carry things in and out all the time. Let's see, what I want to cover today. Nutrition. This is very important because post surgery, for recovery, they want you on a high protein diet. So anything high protein, meat, chicken, fish. Try to stay away from the red meat because it's not good for you anyway, and the protein works a little bit differently. So chicken, fish, pork's okay. I'm not a huge pork person, but that's good. And if you're vegan or vegetarian, there are other ways to get your protein too. I do a lot of bran flakes, which have protein in them. So for a fortified cereal, beans have protein in them. So, you may want to consult a nutritionist for your particular needs, but you want to have a good diet. Stay away from the junk food, folks. That's what got you there in the first place. And yeah, it's tempting to go back to it, but believe me, you don't want to go that route again because once you've had the surgery, and chances are you may have even had a gastric bypass or something, you don't want to have to go through all that again. I got both cats on the bed. You got to see this. I wasn't able to make my bed this morning for that reason. Check it out, folks. There's Baxter and Milo. Everybody always asks about them. They're doing fine. They're just kind of sitting here and watching me. So on the skincare, can you do massage stuff? Justin Lyons asked. That's a very good question. You can get massages, but not right after. As a matter of fact, the last time I went to Massage Lux to get a massage, and this was when they saw the scars, they had to ask me how long that it had been post surgery. So that's a good question. You will be able to get massages, but not right away. You probably have to wait about 6 months or so. Ooh. All right, folks, I think I'm going to end it here. Actually starting to lose my voice, but thank you all for coming. Again, I'm sure a lot of you'll see this post production. Stay safe. Please continue to like and subscribe. I'm going to try to do some more live streams, probably not videos for a while until I can lift again. And as always, have a blessed day, everybody.